everyone. Today I have with me Dr. Boehm. She's a physical therapist. Dr. Boehm,
Hello, hello. Nice to see you again.
hi. All right. So today we're going to ask her a couple of questions. So starting with the first question. So how did you choose medicine and why physical therapy especially?
Yeah, that's a great question. I think most people who go into medicine go in because they want to help people, right? You probably hear that from most people. I knew that that was something that was, one of my values and something that I really wanted in a career to feel very fulfilled as I went to work. Physical therapy specifically, that kind of came for a couple of reasons. First of all, I knew I wasn't really into like the blood and like injections and all of that, so I that kind of cut out a few a few medical professions for me. When I was, I think, a freshman in high school, I went and shadowed a physical therapist and thought it was kind of neat, right? Just kind of went around and shadowed some different jobs. And then when I was a sophomore in high school, I tore my ACL and then went through the patient side of things with physical therapists and really enjoyed it. As I did more shadowing and just kind of saw what physical therapists did, I really enjoyed that, we got to spend a lot more time with our patients and got to see the progress over time, as they continued through their rehabilitation. And then the other piece, I just really like, the concept of being active and having like an active, healthy lifestyle, and found that that really fit in with physical therapy as well.
Absolutely. And I hope people who are watching this video as well are aspiring to be physical therapists as well can relate with that too. So what exactly do physical therapists do? Because like I think from outside the sports medicine seems like a really big, specialty. So what exactly do physical therapists especially focus on?
Yeah, so that is a big question because we pop up in a lot of different settings. So when you break it down, a physical therapist is the expert in movement and really what affects movement. So if you think about, across medicine, across even, healthy individuals, if someone is moving differently and that's affecting them in a negative way, right, they can see a physical therapist to help with that. Kind of getting into, where we can be. Again, it's a broad spectrum. So I think most people think of physical therapists as that like sports medicine therapist, right? You get hurt in sports and then you go to a PT and you get better. That definitely is a piece of it, right? We kind of call that like our orthopedic world, right? Working with joints, bones, muscles, things like that. But we do also work in like a hospital setting. So someone who may just be very deconditioned. We do have physical therapists that work in the ICU as well, which is kind of neat, right? So it may be someone who's fully sedated and we need to make sure that, hey, they don't get too stiff, so we need to get them up and get them moving, get that blood flow. There's also therapists who work with more neurological conditions, so traumatic brain injuries, strokes, things of that nature. There are some different specialties as well, which are really interesting. You can work with pediatrics or with pelvic health and women's health. Some other settings include home health, where you're actually going into people's homes and helping them out if they're unable to get out into like an outpatient setting. So yeah, there's a really big broad spectrum. But again, if you kind of break it down into, we assess and treat movement and movement disorders, that's probably where you can get the most bang for your buck with understanding PT.
That is that I think that's a very needed like explanation just to make sure that everybody understands what each career does. So thank you so much for defining that.
Yeah.
My next question is, what is the hardest part about your job? And this is probably one of the harder questions that everyone gets, but what do you think is the hardest part of your job?
Yeah, absolutely. I think it ended up coming down to, there's so many things out there that we can do to help, and there's sometimes only so much we can do. So, that can be from a couple different perspectives. So that can be from, ranging from a patient might just not be ready to make a change, right? And that can be really frustrating because we can know what we want to do or what would help, but they might just not be there yet. But then from the other side, right, sometimes we run out of time to work with them, right? In the world of insurance, sometimes they don't approve things. And as much as we want to help people, there are financial decisions that need to be made in terms of their care too. So that can be very frustrating. In the setting, in the workplace that I work with, we're pretty interdisciplinary, right? We work with a lot of other professions, but that can be really frustrating. And in certain settings, that is a bit harder to do. And I can find that that's a really big barrier as well.
Absolutely. So for me, the next question I think, which is like high in demand, is how does a day in a life of a physical therapist look? Like, how are the hours and what kind of like different patients do you personally see? Like, what do they deal with?
Yeah. So again, there's so many different types of physical therapists in so many different settings. So if you talk to someone in a different setting, they would give you a totally different answer. So I work in an outpatient orthopedic clinic, and it's a hospital-based clinic. So I work only during the week. I don't work on the weekends, which is nice. In the setting that I work in, we can be fairly flexible depending on the needs of the clinic. So I used to do 4 10-hour days, and now I do kind of a smattering of different hour days. I work 40 hours a week, but I have like a 9-hour day and a 6-hour day, and I kind of, go back and forth. But again, traditionally, I'm working 40 hours a week and just not on the weekends. Now, the population that I see, again, is primarily outpatient orthopedics. So that is my specialty. So I see, again, a lot of joint, bone, muscle disorders. I'm typically seeing an adult population, although I have seen patients as young as about 9. I think my oldest patient is about 101, I think is the oldest that I've seen. But typically I'm seeing probably somewhere between like 40 and 60 maybe on average. Typically for our setting, I see people like new patients, I see for about an hour one-on-one. And then if they're a recurring patient and we've already done our big assessment, I'm seeing them for about a half hour. Now, depending on what the person has going on, if they had a surgery, they just have general pain, or they just want to work on their balance. What's nice is we can collaborate on a plan on how often we see them. So there's some people I see as, as infrequent as 2 visits, and I see them once, and then maybe in a month I check in. There's some people I see as often as twice a week or even 3 times a week, and for up to 3 months. So again, that's all depending on their diagnosis and what we feel like is the best plan. So the nice thing is I'm seeing a lot of these people very frequently, and I get to see them one-on-one, which is fantastic, because I know in a lot of other professions, right, it's really quick that you get to see your patients and you're seeing a lot of them.
Absolutely. Thank you so much for explaining that. Now, say a person really wants to go into physical therapy after watching this interview because they really are like, okay, this is what I want to do. What would be the educational pathway that they would have to follow?
Yeah, that's a great question too, because it has changed in the last like 10, 15 years. So when physical therapy started out, it was just a bachelor's degree. It then went to a master's, and now it's a doctorate degree. There's no programs out there anymore that are a master's. When I was going through school, there was one that just needed to update their schooling. So what that means is you would go to your traditional 4-year undergraduate degree. A lot of physical therapy schools are very open to whatever major you want, but you have to just have your prerequisites. So most people are going into exercise science, kinesiology, biology, biochem, psychology. Those are kind of the most common ones, with biochem probably being the least common. But, again, hypothetically, I mean, you could be an art major, but just have all of your prerequisites. Now, it'd be goofy to be an art major and have that many science classes, but hey, you do you, right? The prerequisites are typically, again, a lot of science classes. There's a statistic class that you have to take in there. And then, again, that's going to be dependent on the school. So looking that up. After you're done with your 4-year undergraduate, or how quickly it takes you, then there's typically it's a 3-year graduate program. Now, there are some programs out there that are starting to have a little bit more accelerated of a graduate program where you may be able to get done in about 2 or 2.5 years. Again, very dependent on where you're at. Typically in the graduate program, at least for the last 2 years, it's year round. So you're either taking classes in the summer or you're out on internships, working during the summer. And then after that, you graduate, you get your doctorate of physical therapy program. And then there's a big exam, you take a board exam, and that is just right after you graduate. Sometimes you can take it a little bit early. It's about a 6-hour exam. Again, just goes through all of the things you learn in school. And then after that, you're licensed and ready to work.
That sounds perfect. Thank you so much for spending all this time with us and giving so much valuable information. I know that a lot of people in our club are actually looking into physical therapy. So hopefully you guys also find this video really helpful. But thank you, Dr. Boehm, for spending all this time with us and for all the information. Thank you.
Yeah, absolutely.
Thank you. All right, guys. See you guys next time. Bye.